Caring for a newborn's umbilical cord is a vital part of early parenthood, and it's something every mother can manage confidently with the right knowledge and attention. The umbilical cord is more than just a physical connection between mother and baby. It's a symbol of life, nourishment, and the bond that begins in the womb. After birth, the cord is clamped and cut, leaving a small stump on your baby's belly. This stump will dry out, shrivel, and eventually fall off on its own, usually within the first 1 to 3 weeks. During this time, proper care is essential to prevent infection and ensure that healing occurs smoothly. Understanding the importance of umbilical cord care begins with recognizing its role in your baby's health. In the womb, the cord carries nutrients and oxygen from mother to child, supporting growth and development. After birth, the cord stump becomes a delicate area requiring gentle attention. The risk of infection is highest in the days before the stump falls off, so careful hygiene is paramount. The process of caring for the umbilical cord stump is straightforward and does not require specialized medical training. It is, however, crucial to follow best practices and stay attentive to any signs of complications. Let's explore the essential steps and considerations every mother should know, empowering you to provide the best care for your newborn. First, always wash your hands thoroughly before handling your baby or touching the cord area. Newborns have developing immune systems, and clean hands are the first line of defense against infection. Use soap and water, scrubbing for at least 20 seconds, and dry your hands with a clean towel. Next, keep the cord stump clean and dry. This is the most important principle of umbilical cord care. In the past, some cultures and traditions recommended applying ointments, powders, or alcohol to the stump. But modern medical guidelines advise against this unless specifically directed by your healthcare provider. The natural drying process helps the stump fall off safely. Moisture can delay this process and increase the risk of infection. Bathing your baby requires special attention while the cord stump is still attached. Rather than submerging your baby in a tub, opt for sponge baths to avoid wetting the cord area. Use a soft cloth and lukewarm water to gently clean your baby's skin, steering clear of the stump. If the stump does get wet, gently pat it dry with a clean, soft towel. Clothing and diapers should be arranged to minimize irritation or pressure on the umbilical cord. Fold the diaper down so it rests below the stump, preventing friction and allowing air circulation. Dress your baby in loose-fitting, breathable clothing made from natural fibers like cotton, which reduces the risk of chafing and supports healing. Monitor the cord stump daily for any signs of infection or abnormal changes. A healthy stump will gradually dry out, turn brown or black, and shrink before falling off. Watch for redness, swelling, foul odor, pus, or bleeding. These could indicate infection and require prompt medical attention. Some slight oozing or a small amount of blood is normal during the first few days, but persistent or heavy bleeding is not. Resist the urge to pull or tug on the stump, even if it appears to be hanging by a thread. Allow the stump to detach naturally. Forced removal can cause bleeding or infection. Most stumps fall off within 1 to 3 weeks, and the area should heal completely within a few days after detachment. After the stump falls off, continue to keep the area clean and dry. You may notice a small scab or a bit of dried blood, which is normal. In rare cases, a small lump called an umbilical granuloma may form. This is not serious, but should be evaluated by your healthcare provider. Recognizing when to seek help is a key aspect of responsible cord care. If you notice any of the following, consult your pediatrician or healthcare provider promptly. Redness spreading from the cord, swelling, pus or fluid drainage, foul-smelling odor, persistent bleeding, or if your baby develops a fever or seems unusually irritable. These signs may indicate infection and require medical attention. Alongside practical care, understanding the emotional aspects of umbilical cord care can be reassuring for mothers. Many women experience anxiety about harming their baby or making a mistake. Remember, gentle, attentive care is sufficient. Trust your instincts and don't hesitate to ask for guidance from nurses, midwives, or doctors if you have concerns. Family members and caregivers can play a supportive role. Encourage everyone who handles the baby to practice hand hygiene And be mindful of the cord area. Sharing information and collaborating creates a safe, nurturing environment for your newborn. Educating yourself about normal healing and possible complications helps reduce worry and build confidence. Most babies experience a smooth transition, with the cord stump falling off and the belly button healing without incident. With vigilance and gentle care, you can promote your baby's health and comfort during this brief but significant period. In addition to the physical care, the process of tending to your baby's umbilical cord is a chance to bond and express love. Every diaper change, bath, or gentle touch is an opportunity to connect with your newborn, fostering trust and security. As your baby grows and the cord stump falls away, you may notice the belly button's final appearance. Some babies have an innie, while others have an outie. Both are normal and determined by natural healing, not by cord care techniques. Old myths about taping coins or applying pressure to influence the shape are unfounded and unnecessary. Umbilical cord care also varies slightly in special circumstances. Premature babies or those with certain medical conditions may require additional monitoring or specialized care. If your baby was born in a hospital, nurses will often provide initial care and guidance. For home births or early discharge, your healthcare provider will instruct you on specific steps and answer any questions. Cultural practices and traditions surrounding cord care are diverse. While some families have rituals or beliefs about the cord's significance, it's important to balance tradition with medical advice. If you wish to incorporate cultural elements, discuss them with your healthcare provider to ensure safety. The transition from umbilical cord to belly button is a natural milestone, marking your baby's journey from the womb to the world. As a mother, your attentive care supports this process and lays the foundation for lifelong health. Let's delve deeper into some frequently asked questions and concerns mothers have about umbilical cord care. Is it normal for the cord stump to smell? As the stump dries and separates, a faint odor may develop. However, a strong, foul smell, especially accompanied by discharge or redness, can signal infection and should prompt a call to your healthcare provider. Can I bathe my baby before the cord falls off? Yes, you can give your baby sponge baths, carefully avoiding getting the cord stump wet. Full immersion baths should wait until the stump has fallen off and the area has healed. What should I do if the cord stump bleeds? A small amount of bleeding is common when the stump rubs against diapers or clothing or as it falls off. Apply gentle pressure with a clean cloth. If bleeding is persistent or heavy, seek medical advice. Is it safe to use alcohol or antiseptics on the cord stump? Modern guidelines recommend keeping the stump dry and clean without applying alcohol or antiseptics unless advised by your healthcare provider. These substances can sometimes delay healing. Why is my baby's belly button oozing after the cord falls off? A small amount of clear or yellowish fluid may ooze as the area heals. However, pus, persistent drainage, or redness should be evaluated by a doctor. Should I cover the cord stump with a bandage? Usually, the cord stump does not require a bandage. Allowing air to circulate helps it dry out. If your healthcare provider recommends a covering due to specific circumstances, follow their instructions. What is umbilical granuloma? Occasionally, after the stump falls off, a small, moist, pinkish lump may appear. This is called an umbilical granuloma. It is not dangerous, but may need simple treatment by your pediatrician. Umbilical cord care is not only about physical health, it's an opportunity to nurture your baby and establish routines of protection and tenderness. Your baby depends on you for comfort and safety, and each gentle act helps strengthen your bond. Let's consider the emotional journey of new motherhood as it relates to cord care. Many mothers feel apprehensive about handling their newborn, worried that they may cause harm or overlook important details. It's natural to feel this way, especially when faced with something unfamiliar. Remember, you are learning alongside your baby, and each day brings new confidence and skills. Support from family, friends, and healthcare professionals can ease this transition. Don't hesitate to reach out with questions, share your experiences, and seek reassurance. Every mother's journey is unique, and there is no single right way to approach cord care, as long as you follow safe, evidence-based practices. For mothers of twins or multiples, cord care requires the same attention for each baby. Establishing a routine, Washing your hands, checking each stump, and keeping diapers away from the area makes the process manageable and consistent. As your baby grows and the umbilical cord stump falls off, celebrate this milestone. It's a sign of healthy development, and the belly button will become a lasting reminder of your baby's earliest days. In summary, the essential principles of umbilical cord care are simple. Keep the stump clean and dry, avoid unnecessary interventions, monitor for signs of infection, and seek help if needed. Every mother can master these steps, providing safe and loving care for her newborn. Your role as a caregiver in these early days sets the tone for your baby's well-being. The trust and comfort you provide, even in small acts like cord care, build a foundation of health and security. Beyond the practical steps, remember that your attention and presence are powerful. Babies sense and respond to gentle touch, soothing words, and the rhythm of your care. Each interaction is a chance to bond, nurture, and celebrate the new life you've brought into the world. As the days pass and your baby grows, reflect on the journey from pregnancy to birth and now to parenthood. Caring for the umbilical cord is just one chapter in the story, but it is an important one. With patience, attentiveness, and love, you are more than capable of providing the care your baby needs. If you ever feel uncertain or overwhelmed, remember that help is available. Pediatricians, nurses, and experienced mothers can offer guidance and support. Trust in your ability to learn and adapt, and know that every act of care strengthens your bond with your baby. Umbilical cord care is a universal experience shared by mothers around the world. Whether in a bustling city hospital, a quiet rural home, or anywhere in between, the principles remain the same. Cleanliness, dryness, gentle handling, and vigilance create the safest environment for healing. Take pride in your role as a mother and embrace the responsibility and joy of caring for your newborn. Each diaper change, bath, and gentle inspection is a testament to your love and dedication. The umbilical cord, once a lifeline, now marks the beginning of your baby's journey in the world and your journey as a parent. As you care for your baby, remember that you are not alone. Generations of mothers have walked this path, sharing knowledge, wisdom, and support. Your confidence will grow with each day, and the trust you build with your baby will last a lifetime. In closing, remember these key points for umbilical cord care. Always wash your hands before touching your baby or the cord area. Keep the stump clean and dry. Avoid applying substances unless directed by your doctor. Give sponge baths until the stump falls off and the area heals. Fold diapers below the stump to prevent rubbing and allow air circulation. Monitor daily for signs of infection, redness, swelling, odor, pus, or persistent bleeding. Allow the stump to fall off naturally. Do not pull or force removal. After the stump falls off, keep the area clean and continue to watch for changes. Seek medical advice promptly if you notice signs of infection or are concerned. With these simple practices, any mother can confidently care for her baby's umbilical cord, ensuring safety, comfort, and healthy healing. The journey from cord to belly button is brief but significant, and your attentive care makes all the difference. Cherish these moments, trust in your abilities, and know that you are providing the very best for your newborn. The love, care, and attention you give now lay the foundation for a lifetime of health, happiness, and connection. Every mother can do it, and so can you.